Welcome back to our series on extreme environments. Today, we are tackling the big one, the ultimate frontier, space. It's an environment so hostile, so completely alien to our biology, that just being there forces the human body to basically rewrite its own rulebook. And the ways it does that are both terrifying and, honestly, absolutely fascinating.
Okay, let's just dive right into the deep end with a question that really gets to the heart of the problem. And I'm not talking about a sprained ankle. Think bigger. What happens if you have a ruptured appendix or a traumatic injury from some kind of explosion? What do you do when the nearest ER is literally on another planet?
You know, here on Earth, you call for an ambulance and help is minutes away. On a future mission to Mars, the fastest possible help you can get from an expert back home is a radio signal. And because of the distance, that signal takes up to 40 minutes for a round trip. That's not for an ambulance to show up, that's just to ask a question and get a single reply. It means any serious medical crisis has to be handled right then and there, completely autonomously, by the crew.
But the challenges start way before you ever set foot on Mars. They begin the very second you decide to leave our planet, with the violent, absolutely crushing forces of just trying to escape gravity. A routine launch shoves you back into your seat with about 4 to 5 times the normal force of gravity. We call that 4 to 5 Gs. But look at the historical extremes. Yuri Gagarin, the very first human in space, had to endure 8 Gs on his way back. And the Apollo crews, they experienced a staggering 17 Gs. These are the kinds of forces that can shake equipment loose and push the human body to its absolute breaking point. And then you've got the heat. During re-entry, the friction with our atmosphere basically turns the spacecraft into a man-made meteor, with the outer shell heating up to temperatures hotter than the surface of the sun. It was a failure in that heat shielding, that protection, that led to the tragic loss of the Space Shuttle Columbia and its 7-member crew.
So, let's say you survive the journey and you finally make it into orbit. That's when the real strangeness begins. In the absence of gravity, an environment we call microgravity, your body starts a profound and bizarre transformation. It begins adapting to a world it was never, ever designed for.
Think about it. Here on Earth, gravity is constantly pulling fluids down into your legs. In space, that pull just vanishes. So within minutes, all that fluid rushes upwards into your chest and your head. This gives astronauts a puffy face, constant sinus congestion, and really skinny legs, a condition they fittingly call chicken leg syndrome.
And we're not talking about a little bit of fluid. This is a massive redistribution. We're talking up to 2 liters. That's the equivalent of a big soda bottle's worth of fluid moving from your lower body into your core. Your body gets confused, it thinks it has way too much fluid, and it starts trying to get rid of it. This means for pretty much their entire mission, astronauts are in a state of relative dehydration.
Now, what happens to your skeleton is even more alarming. Without the constant stress of gravity telling them to stay strong, your bones just start to demineralize at a shocking rate. An astronaut loses bone density about 10 times faster than an elderly person with osteoporosis. This, of course, raises the risk of fractures and also painful kidney stones, which can be caused by all that excess calcium getting dumped into the bloodstream.
And it's not just your bones. Your muscles also start to waste away because they're just not being used. The anti-gravity muscles, the ones in your calves and thighs that you use every day just to stand and walk, they get hit the hardest. They can lose up to 17% of their volume. This is exactly why astronauts on the International Space Station have to exercise for 2 hours every single day, just to try and slow down that decline.
And the list of weird adaptations just keeps going. Your spine actually decompresses without gravity, so you can grow a few inches taller. Your inner ear gets totally confused, which leads to space motion sickness in up to 80% of astronauts. And remember that fluid shift? All that congestion dulls your sense of taste and smell, which is why astronauts often crave super spicy food.
But perhaps one of the most serious long-term issues is what spaceflight does to your eyes. A majority of astronauts on long missions report that their vision gets worse. That same fluid shift can increase the pressure inside your skull, which can physically flatten the back of your eyeballs and swell the optic nerve. It's a condition called VI-VIP syndrome. And what's really frightening is that some of these changes can be permanent.
So while your body is busy adapting or, falling apart from the inside, it's also being constantly bombarded by invisible threats from the outside.
Once you leave Earth's protective magnetic field, you're flying through a sea of radiation. We're talking about high-energy particles called galactic cosmic rays. They basically act like microscopic bullets, slicing right through the spacecraft and the astronauts, damaging DNA, and increasing the long-term risk of cancer and nervous system damage.
And right now, our shielding just isn't good enough for a trip to Mars.
Oh, and getting a good night's sleep? Yeah, that's nearly impossible. The International Space Station whips around the Earth every 90 minutes. That means astronauts see 16 sunroses and 16 sunsets every single 24 hours. As you can imagine, this just completely wrecks their natural body clock, leading to chronic sleep deprivation and fatigue.
Even just taking a walk outside is packed with danger. You see, for a spacewalk, astronauts have to go from the station's normal air pressure to the much lower pressure inside a spacesuit. If you do that too fast, nitrogen bubbles can form in your blood. It's the same exact thing that happens to deep-sea divers, known as the bends. This is dramatically illustrated by the crazy story of Alexei Leonov. After the first-ever spacewalk, his suit inflated like a balloon, and he had to dangerously vent precious air from it just to squeeze himself back inside his capsule.
And all of this brings us right back to our central question. With a body that's been so strangely twisted and adapted, and in an environment this hostile, what in the world actually happens when you need to do surgery in space?
An operating room in space is a completely alien concept. On Earth, gravity is your friend. It holds your patient down. It keeps your tools on the tray. In space, everything floats. An air bubble in an IV line doesn't just rise to the top. It mixes with the fluid and creates a foam. Your patient is already what we call hypovolemic, meaning they have low blood volume, and they're probably anemic. And their airway is swollen, making something like putting in a breathing tube incredibly difficult.
So because the crew members doing this procedure won't be specialists, any plan has to be simple. It has to be like a checklist. Here's one proposal. First, you have to physically restrain everyone and everything. You'd probably use a drug like ketamine, which is stable and works well in dehydrated patients. And you'd rely on an all-intravenous technique because using anesthetic gases that you have to somehow capture in a tiny, closed environment is a logistical nightmare.
Well, what about just numbing the area, like an epidural? That's called regional anesthesia. It's a great idea, but it would still mean a non-expert would have to perform a highly technical procedure, like finding one specific nerve with an ultrasound probe, all while they and their patient are floating around. It is a monumental challenge.
And this really gets to the heart of why this specific kind of expertise is so vital. The specialists who already know how to manage a person's body and all the drugs during an emergency on Earth, well, they're the ones best equipped to write a whole new medical rulebook for when the old one gets thrown out the airlock. Which really brings us to our final thought. As we plan these incredible missions to the Moon, to Mars, and even beyond, we are running headfirst into the fundamental limits of our own biology. The greatest challenge of space exploration might not be engineering better rockets, but really understanding and maybe, just maybe, one day, changing ourselves.